Living with acute migraine or cluster headaches can be debilitating. You need effective treatment options, and understanding them is crucial. Let's explore Brekiya, a specific medication designed to help stop these severe headache attacks. Brekiya is a prescription medication used to treat adults experiencing acute migraine attacks, whether they have aura or not. It is also approved for treating acute cluster headaches. It comes as a single-dose autoinjector for injection under the skin. This medication is intended for use at any point during a migraine or cluster headache attack. It is not used to prevent headaches. Brekiya is also not for treating other types of headaches, like hemiplegic or basilar migraines. Brekiya belongs to a class of drugs called ergotamines. It works by targeting specific receptors in your body, primarily serotonin 5-HT1D receptors. These receptors are found in blood vessels and nerve pathways involved in headache pain. By activating these receptors, Brekiya helps constrict blood vessels in the brain that may be dilated during an attack. It also helps block pain signals. This action helps to stop the headache effectively. Brekiya contains the active ingredient dihydroergotamine mesylate. While dihydroergotamine has been used as an injection since 1946, Brekiya as an autoinjector received FDA approval on May 14, 2025. Brekiya is specifically for adults diagnosed with acute migraine or acute cluster headaches. It is used to treat the attack once it has started. Your healthcare provider will determine if Brekiya is appropriate for your specific condition. It is important to note that Brekiya is not a preventative treatment. It will not stop headaches from occurring in the future. It is only for treating an attack that is currently happening. Brekiya should not be used for other headache types. This includes rare or complex forms like hemiplegic migraines, which cause temporary paralysis on one side, or basilar migraines, a rare type with specific aura symptoms. Always confirm your headache diagnosis with your doctor. Brekiya carries significant risks, including a boxed warning. This warning highlights the risk of serious problems with blood circulation, specifically peripheral ischemia, when used with certain medications. Peripheral ischemia can be life-threatening. Peripheral ischemia means reduced blood flow to your limbs, especially legs and feet. Symptoms can include cramping or pain in legs/hips, heaviness, burning pain in feet/toes at rest, numbness, tingling, weakness, coldness, or color changes in limbs. If you experience these, seek emergency medical help immediately. Brekiya can also cause serious heart problems, which may be fatal. These include temporary narrowing of heart arteries, coronary artery vasospasm, reduced blood flow to the heart, transient myocardial ischemia, and dangerous heart rhythm problems, ventricular tachycardia/fibrillation. Brekiya is not safe for everyone. Do not use Brekiya if you are taking strong CYP3A4 inhibitors. These are certain medications that affect how your liver processes drugs and can dangerously increase Brekiya levels, leading to severe peripheral ischemia. You should also not use Brekiya if you have a history of heart problems or currently have heart disease. Uncontrolled high blood pressure is another contraindication. If you have narrowing of blood vessels in your limbs, stomach, or kidneys, peripheral vascular disease, you should not use Brekiya. Before starting Brekiya, have an open conversation with your healthcare provider. Tell them about all your medical conditions. This includes if you have high blood pressure, liver problems, or kidney problems. It is especially important to mention if you have risk factors for heart disease. These include high cholesterol, smoking, being overweight, having diabetes, or a family history of heart disease. Your doctor may need to perform a heart exam before prescribing Brekiya. Inform your doctor if you are currently taking any strong CYP3A4 inhibitors. As mentioned, combining these with Brekiya is dangerous. Provide a full list of all prescription and over-the-counter medicines, vitamins, and herbal supplements you use. Tell your doctor if you are pregnant, plan to become pregnant, are breastfeeding, or plan to breastfeed. Brekiya can cause preterm labor and should not be used during pregnancy. It can also pass into breast milk and may harm your baby, potentially reducing milk supply. If you are breastfeeding, you should not breastfeed while using Brekiya and for 3 days after your last dose. Discuss the best way to feed your baby with your healthcare provider if you need to use Brekiya. Brekiya is administered as an injection under the skin, subcutaneous. It should be injected into the skin of your upper middle thigh. Use Brekiya exactly as your healthcare provider instructs you. For some individuals, the first dose of Brekiya may need to be given in a healthcare provider's office or another medical setting. Ask your doctor if this applies to you. Each autoinjector contains 1 dose, 1 mg, of Brekiya. You can give your first injection at any point during your migraine or cluster headache attack. It is often recommended to use it at the start of the attack for best results. If your headache returns after the first dose, you may give yourself up to 2 additional doses as needed. It is crucial to wait at least 1 hour between doses. Do not inject more than 3 doses, 3 mg, in a 24-hour period. Also, do not exceed a total of 6 doses, 6 mg, in a 1-week, 7-day period. Using Brekiya too frequently, specifically 10 or more days in 1 month, can worsen your headaches. Keep a headache diary to track when you have headaches and when you use Brekiya. This information is helpful for discussions with your doctor about how well the medication is working. Detailed instructions on how to use the autoinjector are provided with the medication. Read these instructions carefully before using Brekiya. If you accidentally use too much Brekiya, seek immediate medical help by calling your healthcare provider, the poison helpline, or going to the nearest emergency room. Brekiya can interact with many other medications, potentially causing serious side effects. It is essential to tell your healthcare provider about all the medicines you take. This includes prescription drugs, over-the-counter medicines, vitamins, and herbal supplements. Specifically, tell your doctor if you take triptans, like sumatriptan, other ergot-type medicines, or medicines that can constrict blood vessels or increase blood pressure. As mentioned, strong CYP3A4 inhibitors are strictly contraindicated. Examples include certain antiviral medications, ritonavir, indinavir, melphinavir, sequinavir, and certain antibiotics/antifungals, clarithromycin, erythromycin, itraconazole, ketoconazole. Other medications to discuss with your doctor include fluconazole, propranolol or other heart rate lowering medicines, Xilotine, selective serotonin reuptake inhibitors, SSRIs, nefazodone, and even nicotine. Grapefruit juice can also interact with Brekiya. This is not a complete list of all possible interactions. Your healthcare provider is the best resource to determine if Brekiya is safe to take with your other medications. Always ask your doctor or pharmacist if you are unsure. Proper storage of Brekiya is important to maintain its effectiveness and safety. Store Brekiya at room temperature, specifically between 68 degrees Fahrenheit and 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius. Do not refrigerate or freeze Brekiya. Protect the autoinjectors from light. Keep them in their original packaging until you are ready to use them. Always store Brekiya out of the reach of children.